and welcome to Patient Preferred Presents. On this amazing new show, we will be introducing you to some of today's top physicians and leaders in the healthcare industry while sharing new discoveries, medical procedures, expert advice, and answering all of your healthcare concerns. So stick around. You don't want to miss today's episode.
Hello and welcome into another edition of Patient Preferred Presents. My name is Jay Mcfarland, and today I'm very excited to introduce you to patient preferred physician, Dr. Rimma Finkel. Dr. Finkel is double board certified by the American Board of Surgery and the American Board of Plastic Surgery. She is highly skilled in all surgical procedures and specializes in cosmetic, plastic, and reconstructive surgeries. All right, doctor, it's a real pleasure having you on the show today. I'm excited to get to know you and your background. One of my favorite questions to ask is, when did you know, or what was the process that made you decide that you wanted to go into medicine?
So when I was 14, my dad had a quintuple bypass. So that sort of started the journey for me because obviously it was a big surgery and a lot of recovery. And, there were a lot of people sort of involved in the whole process. And that's kind of when I realized I really wanted to do something in healthcare. And I spent time with some of his doctors and decided that I really liked kind of the physician part of healthcare. So that's sort of when it started for me.
Fantastic. So at the age of 14 and watching a loved one getting treatment and experiencing that whole process. Absolutely. Wow. Yeah, and then what led you towards reconstructive surgery?
So when I went to med school, I actually was planning on doing cardiothoracic surgery because I had spent time with his surgeons and it was really interesting and there was all kinds of different things. And then I got into med school and, as part of med school, you do rotations in different specialties and in different primary cares to kind of get a feel for everything. So when I got done with med school, I knew I wanted to be a surgeon. And I wasn't as sure what kind of surgeon at that point. I actually did general surgery first, which I'm old enough. That's how you did it. And I did general surgery. And part of general surgery residency is that you take different rotations with different specialties. That's part of how you learn what to do and when you should do things, when you shouldn't do things. I got lucky enough to spend a lot of time with a really good plastic surgeon who did a lot of reconstruction, some cosmetic, a little bit of this, a little bit of that. And it was fun. It was interesting. It was diverse. There was a lot of different things you could do. So that kind of started me down that path.
So we went from wanting to do medicine, then to surgery, and then to reconstructive surgery. And now even focusing more on breast procedures, correct?
Correct. The majority of what I do is breast and breast reconstruction. And it's generally very fulfilling. I get to fix things that are, I can't say they're broken. They're just, in trouble, I guess is a good way to put it. And it's, my patients are generally happy. And when we're done with things and once they get through with their treatments, it's nice. It's a good place to be.
So it sounds like it's fulfilling work to you.
Yeah, it is. So, I enjoy it. I mean, it's not for everybody, but I do enjoy it.
Yeah. So the process when people come to you, is it typically because they're not satisfied with the way they look, or is it because they had a mastectomy or something like that, or is it a combination?
So the majority of the time, I'm actually seeing patients before they have their cancer surgery. Because I work in conjunction with their breast surgeon. We do them in tandem. So when the breast surgeon is done with their part, I sort of take over to do the reconstruction. We try to do everything kind of all at once so that you go into surgery with your breasts and you come out of surgery with your breasts. So that's what the end goal is to be able to do everything kind of all at once.
I can only imagine what people facing this go through, and to have that entire process, occur in a single going. I know it's not a single going. I know that this is a long process.
Sure.
Yeah, and I can only imagine the emotional toll that they're facing, because this is a life-threatening situation and it's going to affect their physical appearance.
Correct. And, I try to educate patients on what their options are, what the risks are, because even though this is, scary, you got to kind of go into it knowing what can happen and what to expect, so that you're kind of prepared for things. And that's the most important part of my job. It's not so much trying to take the fear away. That's hard to do. You get a cancer diagnosis and you forget everything that they said before that word and everything that they said after that word. That's the only word people hear. And so it's very hard to necessarily get them out of that mind frame that, oh my God, I have cancer and I'm going to die. But the reality is most people with breast cancer aren't going to die of their disease. Some will, most won't. And that my job is to give you your options, let you know what you can do, and try to walk you through the process.
Right. So first, your concern is survival, and then after that, eventually, I imagine you get to the place where you're like, how is this going to impact me for the rest of my life?
Right. And I think a lot of people get overwhelmed when they get the cancer diagnosis, and then they're dealing with surgeons, oncologists, radiation physicians. You sort of get bombarded with information, and it's a lot of information, but I try to let my patients know that I'm always available. If they need to talk to me, if they have questions, they can email, they can call, and we can go through things however many times we need to go through things so they understand what's going on.
Yeah, and you also have people electing to get this procedure done before cancer appears now. Is that becoming more
correct?
Common?
Well, it is and it isn't. What it is so genetic testing for breast cancer is becoming much more common. The American Society of Breast Surgeons basically recommends that anyone who's had a diagnosis of breast cancer have breast cancer genetics testing as well. If they come back positive, they recommend that family members also get tested. That's pretty common. So if you come back with a genetic mutation for breast cancer, then we generally recommend having mastectomy prior to a breast cancer diagnosis, because your risk is higher from the get-go.
Right. And how I know a lot of times as people on the receiving end of medical procedures, what we think about them comes from past technology. And so
Sure.
we're thinking, well, my friend told me this, or I had somebody who had this done 10 years ago. And so
I
now,
hear that a lot.
yeah. And so now I'm afraid of it. How has this technology changed over the years? And what would you tell people who have concerns about that?
Well, I mean, we have very different options for breast reconstruction in this day and age. It's not just a one-size-fits-all proposition. There's implants, there's flaps, there's people who choose to go flat, there's what's called a Goldilocks reconstruction. There's a lot of different options depending on each person. It really isn't a one-size-fits-all sort of proposition. And people are usually surprised that with, especially like Goldilocks or oncoplastic reconstruction or even implant-based reconstruction, that they can go home the same day, which is something that most people are like, what do you mean? I'm not going to be staying for 3 or 4 or 7 days? I'm like, no, we haven't done that in about 30 years. So, stuff changes over time. And I always hear that my mom had this done and it was horrible. And, you kind of have to go through, well, things have changed in the last 20 years since your mom had it done. So it's just something we have to deal with.
Yeah, so it sounds like a huge piece of what you're doing is education.
Yes, that's the biggest part of my job, is just explaining what options people have, what the risks are, so that they understand when they make a decision.
Absolutely. Is there a one procedure that is selected more often than others?
So worldwide, and still in the United States, the most common procedure is still expander or implant-based reconstruction. That makes up probably 90% of reconstructions in this day and age. The rest are all either flap reconstructions or Goldilocks reconstructions, which is a very cute name. But that would be probably the rest of reconstructions in this day and age, but still most common is an implants type reconstruction.
And I'm just curious, we're just coming out of a pandemic, and I know that that has affected whether people can get elected procedures. I know cancer is not an elected process, but
Correct.
reconstruction might be. Has that impacted what you do?
Yes, in some ways that it did. It actually, so last year with the pandemic in full swing during the first and second waves, I think it was, when the federal government sort of set a moratorium for the elective procedures, and then the American Society of Breast Surgery recommended that patients go on medication prior to surgery to try to sort of delay the surgical treatment. It's pushed things back. I don't know that it necessarily it affected when we did things as opposed to what we did. And sometimes it meant that patients wouldn't get their surgery for several months or maybe longer in things that we would normally have done as soon as we would have seen the patient. So it did delay some patients' care because of the problems with getting protective devices, masks, gloves, everything that happened last year with all these shortages that we're still sort of facing. Yeah, it did impact patient care for sure.
Yeah, absolutely. And are you still, you mentioned still having issues getting supplies. Is this ongoing?
Yeah. Yeah, it's still an ongoing problem, not just in offices, but also in the hospitals. They are still dealing with glove shortages and some problems getting sterile gowns. So it's always a little bit of a give and take.
Yeah, and I think that's one of the things that people don't understand is how much COVID is affecting other aspects of life and other aspects of medicine.
Correct. Everyone is annoyed that they have to wear a mask. It's, I understand that everyone is annoyed by this, but the problem is when you're dealing with patients all day, every day, and it's not just masks, it's gloves, it's gowns, everything is a little bit of a struggle to get, then it becomes a really big problem. Last year was a struggle getting alcohol sanitizer.
Oh, really?
Which, yeah. So, when you can't get sanitizer to clean your hands, clean surfaces, everyone becomes more at risk.
Yeah, absolutely. Now, you are an expert in your field, double board certified. I'm curious, what would you consider your greatest accomplishment to date?
Oh, I'm not sure.
Well, let me ask it another way. What gets you up in the morning? When you wake up, you're like, today I get to do, and I'm so excited about it.
Oh, well, anytime I get to do something different, I think is always fun. We as surgeons are always trying to figure out how to do what we do better, how to be more efficient, how to make it safer. And so that's the best part of my day is when I can figure out how to do something better for my patient, in trying new techniques, in doing reconstruction a little bit differently so that I know that things are working better for the patient. That's what gets me up in the morning is how can I make it better?
It's got to be an incredible feeling when somebody has gone through this process and they come out on the other end feeling like they're empowered to move on and able to perhaps live some sense of normalcy after the fact.
Absolutely. The best part is when I see my patients several years out and they've almost forgotten about this part of it. That's the best part when they come to see me for their yearly checkup and they're back to normal. They're doing all their usual stuff. I ask them how they're doing. They're doing great. It's really like they've forgotten what that, 6-week period between getting your diagnosis, having the surgery, getting healed, how that went. And so that's always a good day.
And that whole process, 6 weeks typically?
It takes about 6 weeks to heal from surgery.
Okay.
Treatment takes longer because if they have to do chemo or they have to do radiation, that's always added time. It could take up to a year to get through all of that. But the surgical part, if they do have to have more treatment, the surgical part may be the shortest part of their journey.
I'm curious, what would you say? I think it's important since we are talking about this. What would you say to women out there about the importance of getting regular screenings?
It's absolutely imperative. I think doing self-exams and doing your yearly mammograms cannot be emphasized enough. Mammograms will find smaller things that you don't necessarily feel. And it's always important to know these things. Yeah, they can find things that aren't cancer as well, absolutely. But not doing that stuff and waiting, you should just not do that.
Because early detection, right, has to be
Early
has
detection
to be the
is
key.
exactly early detection for breast cancer, early detection for colon cancer. We have ways to screen, and they're minimally invasive at best. Mammogram's uncomfortable. I've had them. I know what they're like. Nobody likes doing them, but it's not that bad. And it takes about 10 minutes. And then you go on with the rest of your day.
Yeah, great advice. Now, you're a patient-preferred top physician. Patients praise your work with 5-star ratings and reviews. What does it mean to you to be a patient-preferred top physician?
You know what? It's very humbling to know that my patients appreciate what I do and that I try really hard to help them and do the best that I can every day for them. So it's quite the honor.
Well, it certainly is well-deserved.
Thank you.
Yeah, absolutely. What do you think the future is as you see new technologies coming down the pike? Is there anything that is really interesting or that you're excited about in your particular field?
Well, there's always new stuff coming down the pike. We always have new techniques that are being introduced. Fat grafting, which has become more of the standard for filling in small areas and rippling, is probably going to become much more common in larger volumes to recreate a breast that's natural, even though it's not a breast, without doing big giant surgeries like flaps. I think there's going to be a lot more down the pike for kind of growing fat and using that's in the lines. So I think it's going to be interesting over the next 10 or 15 years to see exactly what happens.
Yeah. Now, I understand there's a women's surgeon shortage. And I'm curious what you would say to people, because you kind of went through this process. First, you thought medicine, then you thought surgeon. What would you say to young women who are thinking about becoming doctors and potentially considering surgery?
Well, if surgery is the thing that you love to do, then that's what you should do. You should never sacrifice what you want to do something else. It is a difficult and demanding field, but it's also very rewarding. And so you have to be willing to take the good with the bad. And, I think surgery's not for everybody. That's for sure. Some people it's a lot of time that you spend in training, and it's a lot of time that you're spending after the fact with your patients and in your office and in the OR. But at the end of the day, you're helping people.
Yeah, incredibly rewarding, right?
Yeah, absolutely.
Yeah. And I love the idea that you didn't know you wanted to do this, but because you had the ability to practice and experience different fields within medicine, you found
Correct.
your passion in that way. So maybe instead of deciding I want to be a surgeon, think medicine and then experience some
Right.
of those other fields.
Let yourself. Yeah, I think it's important for people who, I sort of knew what I wanted to do before I went to med school, and that completely changed when I went into med school. And I think that's the thing, is if you focus too much on the thing you think you want to do, you miss out on all the other things that might be the thing you really want to do, where your passion truly lies. So you got to go into it with your eyes open so that you can really experience everything, because you might get to your rotations and be like, oh, well, what I thought I wanted to do is really not that interesting to me, but this is great. And this is like the best thing ever. And that's what I want to do.
That's great advice. Great advice. One last question. I love to ask about hobbies outside of medicine. Is there anything in particular that you like to do?
Well, I'm a ballroom dancer.
Oh, really?
And I do. Yes. and I love to hike. And this is perfect weather in Arizona right now to go hiking, as I'm sure you know. It's not such great weather for you guys to go hiking, but it is perfect weather outside for us. So yeah, that's kind of what I do in my spare time.
Well, it's been such a pleasure getting to know you, and I really love your insight and your advice for those who need to get regular screenings, for those who are in the process, and also for people who are thinking about getting into medicine. I think you've given us some great insight today.
Well, thank you. And I think the best advice I can give for people out there in the general public is don't Google things. Talk to your physician. Talk to your physician first.
I'm so glad you said that, doctor, because everybody's become an epidemiologist in the last 18 months.
Everyone seems to know everything about everything.
Yes.
And even my patients come in and they say, well, I've researched this. And then they tell me what they've researched. And I say, well, it's lovely that you got information, but it's wrong. So let's start from the beginning and go through it all.
Yeah. So I don't mind people searching for information, but include somebody who actually is in the field and has expertise. Yeah.
Exactly.
Yeah.
Exactly.
Yeah.
If you're gonna go researching, at least let us guide you in what you should be looking for.
Yeah, and I love when I hear them say, "I did my research." You doctors and surgeons, that has to drive you out of your mind, because the research you do compared to what they did is
right.
Yeah,
right. When I say I did research, that means either I've been going through the literature for the last 10 days, looking at different articles and looking at the statistics, talking to my peers about what they do, what's considered normal, what's not normal, all this stuff. I do not Google it to see what it says online.
Yeah, great advice. I'm so glad you brought that up. And doctor, it's been such a pleasure getting to know you.
It's very nice to talk to you, Jay.
Once again, I want to thank Dr. Finkel for joining us and congratulate her on being recognized as a patient-preferred physician. I hope that you gained some real insight into her passion. And also, if you're considering looking into medicine or surgery, she gave you some great advice there. And of course, very important information for getting screenings early and being proactive with your health. I'm Jay Mcfarland, and I hope you'll join me next time on another edition of Patient Preferred Presents.